Welcome everyone to Nonprofits Need to Know as staff and volunteers return from remote work to in-person operations. I'm Tim Delaney, President and CEO of the National Council of Nonprofits, and I'm delighted you could join us. We know many of you heard about today's webinar from your state association of nonprofits. If you're not already a member of your local state association, we encourage you to join today so you can be part of the nation's largest network of nonprofits. We don't want you to miss out on important information you need to be the most effective you can be in your own state. We're grateful today for our sponsor, your part-time controller, for making this webinar available to all nonprofits across the country at no charge. Your part-time comptroller, LLC, has been helping executive directors sleep at night by providing expert accounting and financial services to nonprofits for over 27 years. We also thank Zoom for supporting our free public events for nonprofits during the pandemic. And we are thankful to the three experts joining us today to talk about considerations for nonprofits as we start to think about a return to in-person operations. But before we get to today's speakers, I want to do something unusual. I want to promote an event that's already happened. In order to get back to in-person operations, first, we need everyone to get vaccinated. And nonprofits have a very important role to play in doing that. We'll be sending you an email tomorrow with a link to a recording of today's event, but that's not all it will include. That email will also include a link to a special webinar we hosted on Wednesday. We encourage you all to watch it, especially the second half, when leaders of three relatively small local nonprofits talk about how they are helping people in their own communities get connected with vaccines. If we all pitch in and do our part, we can get back to in-person operations of our nonprofits and our lives sooner. And speaking of getting back to in-person operations, that's what we'll be learning about today. You'll get to hear about legal aspects of whether or not to require vaccines, what changes we might see in volunteering, the messages that have proven most effective when talking to staff about vaccinations, and a whole lot more. We hope that today's speakers will answer some of your most pressing questions to ensure that balancing out both of the legal and human aspects of returning to regular in-person operations can happen and happen when it's time. I should note that people can ask your questions through the chat, and we've already received over 500 different questions as you all were registered, so thanks for having great interest. Finally, I need to make a quick disclaimer. While I am an attorney, and we'll be hearing from another attorney in just a minute, we are not your attorneys. While Robin Burroughs will share the contours of current law, what you will be hearing today should not be considered as legal advice to your own organization. If you have any questions about legality or liability, we encourage you to engage your own legal counsel in your own state. Now, on to our first expert speaker. I mentioned Robin Burroughs, and she's our leadoff hitter. Robin Burroughs is an associate with the law firm of Venable, LLP. She assists employers with employment litigation, employment counseling, and labor relations. Robin represents clients in a diverse array of industries, including nonprofit organizations. She works with her clients to address both the practical and the legal factors impacting decisions about employee vaccination policies, employee leave requests, and other employment-related policies and practices. Robin, thank you so much for joining us. The floor is yours.
Thank you, Tim, and thank you everyone for having me today. I will start by trying to share my slides and hopefully not mess up too bad. Okay. So hopefully that worked, and I'm sure someone will tell me if I haven't if I haven't got it. So again, thank you so much for this opportunity. I'm really excited to talk to you today about vaccinations and employment law. I know this is a really challenging and stressful time for a lot of nonprofits who are looking at their workforce and hoping that maybe they can return to the office, or maybe they can expand the operations that they've been already doing during this pandemic. And so I'm excited to tell you a little bit about how vaccines may change that calculus. Okay. So this particular slide I've been using since the beginning of the pandemic. Back to the office, is the end really in sight? Since the very beginning of all of this, I'm sure you all have been using your own cost benefit analysis to try to understand whether it makes sense to be in the physical office, how work from home is going to work for your employees, or if you run the type of nonprofit that requires you to be operational, how to make these difficult decisions about cutting particular programs or modifying programs that you may have to provide in order to meet the folks that you serve. So always we encourage you to gather as much information as you can and to make that cost benefit analysis. And vaccines have really not changed that fundamental aspect of this. You should still be gathering all that information, making those decisions with as much information as you can. And while nobody is making a perfect decision right now, we're all making the best decision we can with the information that we have, trying to figure out whether the benefits of either reopening or expanding what you're already doing outweigh the burdens and potential liability for that. What has changed in that calculus is now the proliferation of vaccines. So as the vaccine rollout continues, we're vaccinating more people every day. We're learning a lot about these vaccines, but there are still a lot that we don't know. And those aspects that we do and don't know really affect both kind of your practical and legal decision making. So we do know that the COVID-19 vaccines are very effective at preventing disease, especially severe illness and death, but also that other preventative steps like masks and distancing help stop the spread of COVID-19. We're still learning how effective the vaccines are against emerging variants of the virus. The information that we have right now, that at least I've read, is looking like the answer is going to be pretty good. But we learn more and more every day about this. We're also still learning how well the vaccines keep people from spreading the disease to both the unvaccinated and to people who are vaccinated. Again, the information we're getting seems to be that they're pretty good at preventing people from spreading the disease, but learning more every day. And we still don't know, and we're learning how long vaccines can protect people. So far, again, it looks good, but people just have not had the vaccines long enough to have reliable information about how long they'll last. And these knowns and unknowns really affect what your workplace is going to be able to do, and what the CDC and other relevant agencies are going to recommend that your workplace do for your vaccinated and unvaccinated individuals. So I'm going to talk today about sort of what we know right now, but know that this is going to change. So if I gave this presentation in a week, it might be different. But I'll tell you the information that we have right now and the best advice that I can give at the moment. But stay in touch with your legal counsel, and of course keep getting as much information as you can, because this is really something that is developing. So right now, as more people are becoming vaccinated, they are starting to do some things in their personal lives that they stopped doing because of the pandemic. I know my parents are really excited to see my kids. This whole idea of visiting grandparents is very popular. But in work settings, after employees receive a COVID-19 vaccine, it may be important to level set with them to make sure that they're still taking steps to protect themselves and others. The current guidance is not that once an employee is vaccinated, everything goes back to normal. This is a new normal that we're in right now. So employers should continue to follow the CDC and OSHA guidance. Today, this includes wearing masks, social distancing, washing hands, and encouraging employees to stay home if they're sick. If you are in a state that has its own OSHA, like California has Cal OSHA, keep up to date on those local guidance issued as well. For instance, right now, CDC and Cal OSHA have, the CDC has changed their quarantine rules a little bit for vaccinated individuals. Cal OSHA has not adopted those CDC recommendations yet. So this is something where you're going to have to look at every level of agency information to be able to get the details that will affect your nonprofit in particular. This guidance, like I said, is changing really rapidly, and we expect basically new updates every day. So try, if you can, I know everyone's doing lots of other things, try to stay as up to date as you can. So with the increase in vaccination, we've gotten a lot of questions about vaccination policies. Should you have a vaccination policy? Should it be mandatory? Should it be voluntary? And what's the legal risk involved with those? Right now, the current EEOC guidance says employers may, if you want, implement a mandatory vaccine policy. And if you do that, you have to honor both religious and medical exemptions to that requirement. I'll talk more about those on the next slide. You may also choose to adopt a non-mandatory vaccine incentive policy. I'll talk a little bit more about what that might look like too. You do not, if you don't want to, have to adopt any vaccine policy. So, but I presume because you're here, you have at least some interest in that. So right now, you have a lot of leeway about what the law will allow you to do. But there are a lot of practical considerations that you should consider if you're going to be adopting a policy. First, any policy should really be written down for something of this significance. So work with your legal counsel if you're going to do that to make sure you're setting up a policy that's appropriate under your specific state local guidance. From a practical matter in choosing what kind of policy you have, you might want to consider if everyone right now is eligible to be vaccinated. As states open up their eligibility requirements, we're seeing more people who can get the vaccine, but that does not necessarily mean that they are able to get access to the vaccine. And that's having some, for employers who want to have a mandatory policy, that's giving some difficulty. So if you're putting in place a mandatory policy that's going to require your employees to drive halfway across your state or to go a long distance in order to get access to a vaccine, that's something you're going to want to consider as both a practical and a legal matter. If you have a mandatory policy, what will you do if an employee refuses to get vaccinated but doesn't have one of these exceptions that I'll talk in more detail about? The answer is really to terminate them. And that's a really difficult outcome. If your best intention is to try to get your employees vaccinated and you're really looking out for everyone's health, are you prepared to terminate people who just refuse to get vaccinated and don't have an exemption? Is that something that you are comfortable with in your own mission? And is that something that what will your workforce look like if you do that? How many people would refuse to be vaccinated if you had a mandatory policy? Is something to consider as you're making these decisions. I get a lot of questions about emergency use authorization. All the vaccines right now that are out there are authorized under emergency use authorization. And when you go to get that vaccine, they'll give you the form that says somewhere in its fine print that there is a right to refuse this vaccine because it is emergency use. Does that matter for your employees? For most private nonprofits, it's not going to matter as a legal matter. The current guidance is really that as a private employer, you can mandate it, even though it is emergency use. But you're probably going to have employees that read that fine print or that think that emergency use authorization is something that makes them nervous. And what will that mean when you either mandate the vaccine or try to incentivize your employees to get it? How will that impact your employee morale? And of course, any policy that you do have needs to be enforced consistently. So the worst thing that you can really do is set up a mandatory vaccine policy and then give everybody exemptions for whatever reason you want, and then not give somebody an exemption because you've decided now's the time you want to enforce it. The policy being written down is really not enough. You have to enforce it consistently in order to both have it give you as much legal protection as it can, and also to avoid claims that you might be unfairly enforcing it or maybe even enforcing it in a discriminatory way. So I mentioned a little bit these required exemptions from mandatory vaccination. They are for disability or for a medical reason that you can't have the vaccine, something like an allergy or a medical condition that would be adverse to having the vaccine. There's also an objection to vaccination for religious objections that are sincerely held and are religious in nature. If you weren't feeling queasy on the last slide about a mandatory vaccination policy, you might be feeling a little uneasy about it now, because if you put one into place, you will have to evaluate whether your employee has a legitimate disability that would prevent them from being vaccinated. And if they do, what reasonable accommodation you could give them from your policy, or whether they have a sincere religious belief that prevents them from vaccination. And these are difficult decisions. Definitely work with legal counsel if you are considering a mandatory vaccination policy and need to be implementing some of these exemptions. But it's something that you need to think about if you're going to be putting this in place, because you will get people who are going to request an exemption from your mandatory policy. So if I've scared you off enough now from a mandatory policy, you may be thinking a voluntary policy might be a better fit. Right now, there's some it's a little wishy-washy about the legality of some of these voluntary programs. A lot of business organizations have been asking the EEOC to weigh in about what kinds of incentives are permissible, and the EEOC has not done that yet. For the moment, the best guidance I can suggest is that businesses are using a lot of cash bonuses or time off for vaccination, and that's becoming a pretty common incentive. Some states have even passed laws requiring time off for vaccination. And if you're giving your employees time off for vaccination, there are some federal leave programs right now that offer a tax incentive for actually providing that time. So time off for vaccination is becoming a pretty common incentive for employers to provide. Other folks want to work within either their wellness program or their health plan. Those things are a little more difficult. They're governed by a very expansive set of laws. So work with your legal counsel if you're interested in kind of going off the beaten path there. And if you have employees with a disability or a religious exemption, you still need to consider how they'll be treated under your voluntary policy. So if you're giving a cash bonus and somebody has a allergy to a vaccine component, you may still be required to give them that cash bonus, even though they don't get the vaccine. As a practical matter, just think through how will you require proof of vaccination, and how long will that incentive be offered? You want to make sure that you're spelling out the program so that everyone's expectations are set appropriately. Under either the mandatory or voluntary policy, you're probably going to want to ask for proof of vaccination. And even a lot of nonprofits that don't want to put in place a policy want to just know, are my employees vaccinated? How many? What does this mean for my workforce? The EEOC has determined that requesting proof of vaccination is not a medical inquiry that would be prohibited under the Americans with Disabilities Act, because just asking somebody the question, have you had the vaccine, the COVID-19 vaccine, doesn't inquire about their disability. But that's about as far as we recommend asking for that question. Follow-up questions could lead to questions about someone's medical condition or potential disability. So we generally don't recommend asking why a person was or was not vaccinated. If what you really need to know is compliance with your vaccination policy, then you really just need to know the kind of yes or no, thumbs up, thumbs down sort of inquiry. If you're thinking about whether to develop a policy, it might be useful to know how many people in your workforce are already vaccinated. You can ask for a reason like that, and you don't need to know why they were or they weren't, what their medical conditions might be. Some folks have also wanted to report their vaccination rate. I would think a little bit about that. If you want to say something like 80% of my business is now vaccinated, like what's that going to change, and who are you going to communicate that to? It's not per se improper to do that, because you are aggregating the information. You're not sharing anyone's specific medical information, but it is something that you want to kind of consider. Why are you asking this question, and what will it change? Because the more information that you have, the more potentially that employees could say you're using it improperly. And I think that we're going to see those sorts of questions raising issues in the future. As you do reopen, or if you're already reopened and have employees who are vaccinated, you're probably thinking about, what can I do with those employees that I couldn't do before? Can I return only vaccinated employees? Can I have my vaccinated employees travel and have my unvaccinated employees stay at home? We don't have a lot of good guidance right now on what might be called vaccination discrimination. There are several states right now that are actually working to potentially pass laws that make your vaccination status a protected category, just like age or religion or disability or gender. None of those bills right now look like they have great traction, but it's definitely on the minds of lawmakers. As a federal matter, vaccination status is not currently a protected category. So technically, yes, you can discriminate between your vaccinated and unvaccinated employees. But just like we were talking about a couple slides ago, we have the medical and religious exemptions that you need to be aware of. And if somebody has not gotten vaccinated for one of those protected reasons, and now you're putting them into that unvaccinated group and giving them fewer benefits or not letting them come into the office, it might be something that would give rise to a claim for discrimination. We're also seeing some concern that employees might be having conversations about vaccination status that could start to touch on the protected categories, things like age or disability, that can lead to inadvertent discrimination. So if you are open and you have employees who are talking about this at the water cooler, just try to monitor those conversations and make sure they're not stepping into protected category territory. Just a few other considerations if you're thinking about having a vaccine policy. Be prepared for some confusion as you roll it out. Try to work on that messaging in advance, and think through all the possible steps that you may need to take. If an employee has a side effect from the vaccine, how will you treat that? Who's going to administer the vaccine? You're probably going to send them out to CVS or a hospital or something like that to try to get the vaccine there. But if you are going to be administering it, there's a lot of extra elements that you have to think about. And as always with any policy, make sure that you're working and communicating with your supervisors and your managers, making sure that they understand it, that they know what questions might be permissible or things that could be a potential problem, and make sure that they're on the alert for the potentially discriminatory conversations that we talked about. So I'll turn it over to, I think Jennifer is going next. I'm really excited to hear what Jennifer and Crystal have to say about talking about to employees and to volunteers.
Great, thanks, Robin. Next up, we have Jennifer Bennett, who joined VolunteerMatch to formalize and manage the organization's volunteer engagement program. With her breadth of experience, Jennifer is well qualified to help VolunteerMatch's community of nonprofits better recruit and engage volunteers. She shares her knowledge with volunteer managers through webinars found on the Learning Center, in newsletters and blog entries, and in person at conferences around the country when COVID is not here. She's a strong believer in the importance of engaging volunteers in meaningful work and was certified in volunteer administration in 2009. She currently volunteers with the Justice and Diversity Center and the Project Homeless Connect in San Francisco and with Social Justice Sewing Academy. Jennifer, Zoom is yours.
Thank you, Tim. Hi, everybody. Today, I'm going to talk a little bit about some of the research that VolunteerMatch has done over the past year with both our nonprofit and our corporate volunteer engagement partners, as well as the research we've done with volunteers. So, and to offer some ideas for moving forward about what this looks like as we move out of COVID-19, as people get vaccinated, and what a potential hybrid model could look like. So we did our first survey to our audiences in March of 2020. And in the third week of March, 93% of our respondents, corporate partners, nonprofit organizations, and volunteers said that they had either canceled all volunteer activities or most volunteer activities. Now that has come down. Our most recent survey in October was about 80% had some or all cancellations. And I do have a little bit of sort of bright, shiny, hopefully future that we are starting to see connection rates on the VolunteerMatch website for prospective volunteers back up to pre-COVID numbers. So there are a lot of people, I think, getting those vaccines, wanting to get out of their house, wanting to volunteer. But we are still seeing sort of a reduction in numbers of open volunteer opportunities. So we're still at about half of what our usual rate of open volunteer opportunities would be. The other thing that we saw coming out of our surveys was reduced financial situations or financial resources compared to pre-pandemic. 63% of our nonprofits were saying in October that they were continuing to operate with reduced resources. So that is a consideration as we move forward, especially building on that next number, with 38% of volunteer managers saying that they've been furloughed, reassigned, or laid off. So as we start to think about reopening, as people are bringing paid staff back and thinking about bringing volunteer staff back, we know that volunteers don't manage themselves, that they need supervision and support. So we need to think about that as well. And that uncertainty is all across the board. A lot of our corporate partners are saying that they're not sure what returning to corporate volunteerism will look like. Probably not those big events of people getting on buses, and nonprofits uncertain about what that could look like for them as well, but also volunteers saying that they're not sure yet. Now, this was October, so hopefully we're starting to see more people as those numbers show us thinking about getting out. But even in October, 80% of volunteers were concerned about being exposed or exposing others. So I think that risk goes both ways. We're not wanting to be the person who brings COVID into their volunteer organization. And then the other sort of bright piece of this, and I'll talk a little bit more about what a hybrid approach could look like. 46% of the nonprofits that responded to our surveys said that they were creating virtual opportunities. We're seeing that on our site as well, doubled the amount of virtual or remote opportunities from before the pandemic. And 36% of the corporate social responsibility programs that participated were interested or starting to think about a hybrid approach. So allowing people to volunteer with their families or from home rather than just focusing on those in-person or single day kind of event opportunities. So to build on some of what Robin was talking about, we want to make sure that we're considering our policies. I never thought that I would be in a situation as a leader of volunteers where I might have to take someone's temperature, but that's sort of where we are right now. So we want to make sure that our policies are supporting the way volunteers work with our organization, whether that's in person and masking or vaccinations, whether that's remote or online. What kinds of policies do we have around Zoom interactions with clients? Things like that. So while we don't necessarily have the same kind of legal framework when we engage volunteers, we certainly want to make sure that we're approaching this with parity. We don't want it to feel like it's a two-tiered system where either volunteers are held to a higher standard or where volunteers are sort of allowed to do whatever they want and paid staff are not, especially when we think about a morale kind of situation there. It's really important that we understand what volunteers are thinking and what they expect when we invite them back. Where are their concerns? Where are their expectations around providing things like PPE, around following policies? To Robin's point as well, if you're going to have a policy, you have to enforce it. It can't be just on paper. And that can be a little bit unsettling. Not all of us feel comfortable maybe having to dismiss a volunteer or terminate a volunteer for failing to wear a mask or coming in when they're coughing. So we need to really understand what those policies are and make sure that the policies that we create are enforceable. On that side, I will also say that we need to think about the boundaries of our volunteers and the boundaries of paid staff or clients, and that we respect them and then enforce them for others, especially if we have volunteers that may not feel comfortable enforcing their own boundaries. So this is where, as leaders of volunteers within an organization, or the policies that we create as leaders of volunteers within an organization, that we're considering volunteers who may not feel like they have the authority to stand up for themselves or may be concerned about sort of making waves. I would also put a note in here about compassion fatigue or sort of volunteer exhaustion, especially for those of you in the hunger fighting field. We know it has been a very long year. The need is way up. Many of your long-term volunteers have been sort of kept at home because they're in higher risk groups. So sometimes we also need to step in and say, hey, we really appreciate how much you're working, but I need you to take a day off too. So that is something to think about, especially when we think about immune systems and staying healthy in general. We don't want our volunteers to get run down. As we think about reopening, it's really important that we think about mission-driven work or impact-driven work. And I'll talk a little bit next about this opportunity where we might be able to right-size our volunteers, that we may have some legacy volunteer opportunities that this could be a good time to look at them to see if they're still serving our organization, serving our mission, and maybe starting to evolve out of some of that more traditional task-based volunteer work and think about how we might be able to create really compelling opportunities. As I said, the interest on VolunteerMatch on our website is up, but people have been stuck in their houses for a long time. I think volunteering having to compete with seeing grandkids and going out to dinner and taking that trip, we might need to ask ourselves if we're doing the best job in creating impact-driven volunteer opportunities. Next slide, please. There we go. This also, and I'm sure that Crystal will touch on this as well, we don't know what's going to happen next. We need to be prepared for change. With that said, if we can say that there's a silver lining coming out of a pandemic, we are so used to change right now. This could be a good time to ask yourselves, what kind of strategic goals do we have for volunteer engagement? Are our volunteer engagement strategies meeting the needs of our organization, our mission, our clients? So there can be an opportunity to tap into that power of change for good. But with variants popping up, with some, who knows what's next, we should be expected to continue to evolve or continue to respond to CDC guidelines or local or regional guidelines to ensure that we're creating a volunteer opportunity that's safe, or as safe as it can be for everyone. We'll talk a little bit about a hybrid volunteer strategy, and I think that this is really our opportunity. We don't want to lose all the amazing innovation and great work that so many of us have done to engage virtual and remote volunteers. How can we keep that? How can we invite those volunteers who maybe were furloughed or had a little bit more flexibility because they were working from home? How do we keep them and not just go back to volunteers have to come during the workday, or every other Saturday, something like that, that there's an opportunity to create more flexibility, to create more engagement. Again, with this possibility that maybe volunteer time might not always win out in a decision between what do I do with the time that I get to spend outside of my house. It's really important that we also, when we start to adapt for uncertainty or continue to change, that we lean on those foundation components that we would use at any time for engaging volunteers. Clear policies and procedures, clear position descriptions, clear decision-making authority or responsibility tracking. The more that we can outline that, the more likely we are to be able to be creative within that structure or within that framework. And I think that what we found in March of 2020, when everything just went, out the window, was that the organizations that had some of this structure in place were more easily able to adapt, more easily able to think about putting everything back on the table and what parts of this work could be done virtually or remotely, and what parts of this work do still really need to be done in person. I think it's the organizations that didn't have as much thought into not just how volunteers are engaged, but why volunteers are engaged, that ran into some real confusion. And we heard stories of organizations just shuttering and not even talking to their volunteers or their volunteer managers about what was coming. Certainly communication, early and often and two-way. As I mentioned, we need to understand what volunteers are expecting, what their concerns are, what they're worried about, so that we can try to mitigate those concerns as much as possible. Obviously, we cannot remove all the risk, but we can do our best to understand and identify where those bigger concerns are. And then this last piece here, holding on to what's worked. Thankfully, VolunteerMatch was not all in the office to begin with. I had sort of a very flexible work from home policy. I'm not looking forward to going back to the office every day from 9 to 5, but I would like to go back sometime. So keeping some of these things like Zoom calls, online orientations, if you set up communication channels from supervisors to volunteers to keep them in the loop over this last year, let's not lose that relationship building or the flexibility that comes with a more remote volunteer corps. I mentioned this idea of hybrid volunteer engagement, especially when we think about potential changes to come, especially if you have an organization that has maybe had to cut back on resources or has had to reassign your volunteer manager. We may not be able to get back up to, February 2020 levels as quickly as we'd like to. So this idea that we can be responsive and flexible. What are the priorities within our organization? What are the priorities for volunteers and volunteer engagement? As I said, it's hard to say there's a silver lining in a pandemic, but this could be an opportunity to right-size volunteer engagement for your organization. Do some of that work around strategic planning, maybe even an operational plan for the next 6 months of how volunteers are getting engaged. How are we retraining or reorienting volunteers that are coming back? Because there will be some things that have changed, certainly with regards to COVID-19 and health and safety, but there may be other things that have changed within your organization's way of delivering services or meeting the needs of clients or your community. The other thing that a hybrid volunteer engagement strategy can bring can allow for more customization. I mentioned those great volunteers who've maybe joined you remotely over the last year because they weren't having to go into the office every day. Is there a way to think about creating more flexible project-based or remote-based volunteer opportunities, maybe with skills-based volunteers or pro bono volunteers? Where are there going to be priorities within your organization? Again, as things start to shift, as things start to change or reopen, we may find that something else comes to the surface. Again, this idea that the first step should be connecting our volunteer work to our mission and to impact. So if you are thinking about what would bring someone back to your organization or how you might be able to best tap into the work of volunteers, one of the things that I like to ask when we used to be able to get together into a room and have a conversation is, if I had a blank check to give you and you could hire as many paid staff people as you want, would you still engage volunteers, and why? What are volunteers uniquely qualified to do within your organization? And again, this could be an opportunity to really focus in on what that meaningful mission-driven work is. And again, as with anything, especially with volunteers where we don't have a lot of sticks for volunteers when we're talking about compliance and following rules, it needs to be carrots. It needs to be what can we do for you? What does the vision of volunteer engagement look like moving forward? How are you a part of it? How do you see yourself as a part of it? And be open to feedback. Again, for the organizations that we work with at VolunteerMatch, the ones that had these communication plans in place that were open to creative ideas, even if they knew in the back of their mind that probably won't work, to allow the volunteers to come to that decision on their own can be really powerful. It can build loyalty, it can strengthen relationships, and that's what we need as we start to go into this next phase of who knows what. So I wanted to leave you guys with a few resources. As I mentioned, we did 4 surveys last year, and that first link will take you to the summaries of the first 3 surveys and then the year in review survey. And I mentioned our learning center, or it was in my bio. We do webinars every week on volunteer engagement, volunteer management, everything from sort of 101 level up through advanced practices. So all free, all online. We'd encourage you to join us if you're looking for some support or guidance around some of these pieces.
Great. Thank you, Jennifer. Delightful insights for everybody. Crystal Sun, Master of Public Health, is an epidemiologist turned data scientist. She oversees Civis analytics, data and analytics work in healthcare and public health. Crystal began her career at the New York City Department of Public Health and Mental Hygiene. While there, she helped develop diabetes management tools for healthcare providers and patients. Crystal then served as an infection prevention epidemiologist at Memorial Sloan Kettering Cancer Center. Crystal, we're all ears.
Great. Thank you so much, Tim and Rick and everybody who is at the Council of Nonprofits for inviting us to speak with you all today. I trust, like Robin said, that you all can see my screen. Please let me know if you cannot. But again, I'm from Civis Analytics. We're a data science advisory and technology firm based in Chicago. We were founded in 2013 by Dan Wagner, who was the Chief Analytics Officer from the Obama 2012 campaign. And for the last year, we've been providing research and testing to help inform the state of Illinois on a couple different things COVID related, but one of them is on how to encourage the public to wear masks in public, get tested for COVID, comply with contact tracing. And then for the last couple of months, we have been helping advise on how to encourage the public to get vaccinated for COVID. And there's a sample of.
Yeah,
Crystal,
excuse me, Crystal, we can see your notes, but we can't really see the slide.
Oh, I'm sorry about that. Let me try that again. I'm going to switch out of presenter view then. Is that any
There you
better?
go.
Sorry
Absolutely.
about that.
Thank you.
So there's a sample of a few of our clients in the nonprofit space listed here on the bottom of the slide. Okay, so we're going to talk a lot about COVID vaccine, obviously, but we've been doing at Civis research on vaccine persuasion since 2018. We've done some studies on how to persuade the public to get a flu shot, as well as looking at how to persuade parents to get their children vaccinated for HPV. One of the advantages of this is that we can look back on this previous research and we can use it as a comparison point. And we are seeing very clear differences in how messaging should be different for COVID as compared to some of these other viruses. Different virus, different environment, different audiences that you want to reach. The way that we come to our conclusion is that we chiefly employ two different types of research. One is public opinion or survey research. And then two is we do a substantial amount of message testing. And on this slide is just a schematic of the way that we approach message testing. We employ what's called a randomized controlled trial testing design. And this is similar to how clinical trials will test drug treatments, for instance. So if you think about the tests to prove the efficacy and safety of the COVID vaccine themselves, there was a randomization of different people into two different arms. One group was randomly assigned to receive the vaccine. Another group was randomly assigned to receive a placebo. And that's essentially what we're doing here. So in our testing, we divide people into several different groups, depending on how many types of messages or creatives you have. We ask a series of pre-screen questions. In the case of COVID, that might be, have you had COVID before? Because some of the receptiveness to messages may be different depending on that status. And then we expose each person to one of the different messages, or they're assigned to a control where they don't see anything at all. Then we ask a post-message question. In this case, it's how likely are you to get the COVID-19 vaccine if and when it's made available to you? And then we do some statistical modeling at the end of it to build and score a model that controls for respondent characteristics. What this does is it allows us to more objectively say that a person's receptiveness or persuasiveness of a certain message is truly due to that message and not because the people that were involved in that study are just different from each other, that they have different baseline willingness to get the vaccine. So one of the biggest reasons why we do not just surveying, but message testing is that we have seen time and time again, not just with COVID, but across all of the research that we've done, is that survey data can be a great place to start and it has a wealth of information. But stopping here doesn't often tell you what message is actually persuasive, and it actually can lead you to some misleading strategies. One example of this is that if you ask in a survey instrument, what is the biggest barrier or challenge for you when it comes to getting the COVID vaccine? Why are you hesitant about it? The number one response that often comes back is that people are concerned about the safety. They're concerned about the accelerated timeline. They're concerned about the serious side effects they could experience. They're concerned that it hasn't been tested enough, particularly in the population that they fall into. So here, as of December 2020, and these numbers haven't really changed, the majority of people will say, 63% of people will say safety or side effects are the biggest concern. So naturally, this leads you or can lead you to developing a strategy that says, okay, if this is the biggest concern that people are reporting, this is what I want to talk about in my messaging. That's what I want to lead with. The problem is when you test different messages, and safety is one of them, we're finding drastically different types of strategies that we would advise our clients to take. Looking at this chart here, what you're seeing in the middle is the safety message. So if you test the safety message against these other core themes like personal stories, statistics, economic recovery, and community, safety often at best is minimally effective, and that's represented by the 0% here. In some cases, for certain populations, it can actually lead to negative backlash, which is actually the probability of someone being less likely to get the vaccine if it were available to them. This isn't something new. This is something that we've seen with other vaccine research. It's also something that we've seen with census research as well, where we were trying to get people to respond to different messages, encouraging them to respond to the US Census in 2020. The most common reason that people cited for being resistant to it was that they were concerned about data privacy and what the government was going to do with their information. But when you actually tested a message that said, your data is secure, the government will go to great lengths to make sure that everything is safe and secure for you, that was often the message that came back with a lot of negative backlash. So in end of January, beginning of February, so we worked with a group, the US Chamber of Commerce Foundation, that was very interested in helping their membership understand how they should talk to their employees, their membership being mostly employers, about the importance of COVID vaccination and play a very important role in persuasion. We know from our data that employers can be a very important messenger. They are reported to be more trusted than government and public health officials, even religious leaders as well, especially if there is no religious affiliation reported by respondents. So I'm going to go through some of the major key takeaways from that study, but just a couple of notes on looking at these results and deciding what it means for you. Number one is that the message test was conducted on a sample of people from the national general population. So as you think about applications for your organizations, I would advise you to think about the composition of your workforce, your volunteers, and how closely they resemble the US. If they're, for example, more or less educated than the national population or have a higher than average number of essential workers, you may want to focus on the findings for those particular subgroups, which we've been able to do in our testing. Number two is the voice in each of these messages that we tested was a generic employer, not a person with a specific role or authority in the organization. So we know that the messenger matters. If you know that whatever messages you are intending to deliver to your organization will be delivered by specific voices, then we always advise testing them specifically in that way. And then number three, information and attitudes are changing rapidly, even just since the beginning of 2021. As it's already been mentioned by several other, by the previous speakers, we're seeing a lot of changes in attitude in just the short period of the last couple of months. So ongoing periodic testing over time is really highly recommended to make sure that your conclusions are based on the freshest data. And then also minimizing the time between testing and then launching your campaign so that you're not launching on stale data. So one of the questions that we wanted to help answer was, do employees actually want their employees want their employers to talk to them about vaccination and encourage it? And we find that most of them want their employers to provide information and encourage it. But as you can see there from the right side, 43% of people actually believe that their employers should mandate this. So sort of just like underscoring some of the points that were made, especially by Robin, that persuasion instead of mandating may be a better route to go in at this point. So in our message test, we tested 5 different messages, and the core theme across all 5 of them is that COVID vaccination is important and you should get vaccinated, but for a different reason. Number 1 was because the vaccine just works. It was a very straightforward, cut and dry. We mentioned the 95% effectiveness rate. Number 2 was economic recovery, and the justification here was that vaccination will help increase job security and stability. Number 3 was healthy workforce community. The reason here was that it helps protect your coworkers and your families and their families. Number 4 was accommodations and incentives. So here we were emphasizing that an employer will make it easy and convenient for you. Maybe they'll do things like scheduling, offering an information hub. Maybe they'll even incentivize it. So it's important here to note that we didn't say that your employer will give you a $5 gift card or a day off. It was kind of, in order to make this most generalizable to all employers, we talk about the possibility of incentives in general. And then number 5 was lead by example. So the explanation here was that your organization's leadership is willing to take it first, take the vaccine themselves when they're eligible. So there's no skipping the line. In a show of solidarity, to show that it's safe, that it's effective, that this is the right move for us as a company or organization. So I don't think that we have a voting function on the call, but I would invite you all to just mentally look at these 5 different messages and take a stab at what you think would be the most persuasive message, maybe for your organization or just in general for all employees or volunteers across the US. So getting into the key findings. So the way that our message testing works is that we provide overall findings across the entire sample, and then we're able to break it up into particular subgroups, whether that's demographics or employer status or other, like I was mentioning before, whether you've had COVID before. Overall, for this message test, we found that the message talking about leadership getting vaccinated first is the most persuasive for employees. That's represented in this figure by the 3%, this pale blue bar. And you're seeing that that's a 3% increase in persuasion for employees to be moved by that message, 3% more likely to say that they would get vaccinated. Economic recovery and healthy workforce community were the 2nd and 3rd. They were a little bit less effective, but as we'll talk about in the next slide or 2, with certain specific subgroups, we saw wider differences. And then effective, you see a 0% here. That means that, ironically, the effective message was not effective or not persuasive. And then accommodations and incentives was not only not effective, but we saw some serious signs that that could lead to some negative backlash. And that's represented by the negative percentage point that you see here. So like I said, it's important to look at it overall as well as for particular subgroups, such as female employees. So here you're seeing that among female employees, which is in this box at the top, economic recovery is a significantly effective message in comparison to the male subgroup. There could be many different reasons for this. This could be because of the disproportionate impact of job loss and job insecurity that women have felt due to the pandemic. Our message testing doesn't allow us to go into the particular reasons why, but I think that's a very plausible explanation. And then accommodations and incentives among females is much more likely to cause backlash than it is for males. Another subgroup that we looked at was essential workers and non-essential workers. And we found that the economic recovery message is an effective message amongst non-essential workers. That's represented by the 3% increase in persuasion, as compared to the 1% increase in persuasion among people who are who identify as essential workers. So in summary, overall, we would recommend showcasing leadership, getting vaccinated, and avoiding messages that discuss accommodations and incentives. But again, it comes back to looking at your group, your audience, and determining how closely they resemble the national population, or if they vary from that by a lot. But for particular subgroups, these recommendations varies. These recommendations vary, so it depends on the composition again. Number one, effective was largely ineffective. We did see some impact on college educated groups though. For economic recovery, we saw that was effective with women, people ages 50 to 64, people with college educations, people who make more than $75,000, Latino respondents, non-essential workers, and people working in settings indoors where they're working in a group space. So they have a little bit more exposure, as well as people working for larger companies. Healthy workforce community was effective with people who are on the younger side, 18 to 34-year-olds, but it's still not the best message to use. Accommodations and incentives, like I said before, I would recommend not leading with this. And then last of all, leading by example is the most persuasive overall, especially for small, mid-sized organizations and female identifying employees. Thank you all for your time today. I'm happy to share these slides with you. If you want to email me directly, it's here, or you can email hello@civisanalytics.com. Thank you.
Crystal, that was amazing. And while you were speaking, I got a call from DC Health. And I was hoping that it was them saying that I was ready to get vaccinated, and it was the mayor saying that everyone needs to get vaccinated, and that it's safe and it's effective. And as she was speaking, I was like, well, I wish she had received your message. So thank you so much. I would love to go into lots of questions because I know we have a lot, but we've already gone over our time allotment. And so unfortunately, there is not going to be time for questions unless I see Rick say, no, we've got time. We do have time. We will make time, by golly. So let me begin by saying thanks to all of our speakers. And then let me turn things over to Rick Cohen, who is our Chief Communications Officer and our Chief Operations Officer, to share some of the questions and get some of the answers. Rick?
Thanks, Tim. And we'll try to keep this as quick as possible because we are after 4 o'clock and we know our presenters do have other things to get to, but we have so many questions. Hopefully we can get a couple of quick answers. One theme that came in both before and during, Robin, this one is for you. You mentioned that we could ask employees whether they got vaccinated or not, but can you ask them for proof? Can you ask them to show their vaccine card?
So yes, you can ask both if they have been vaccinated, and you can ask for proof of vaccination. But when you're asking for proof of vaccination, you need to be careful to not get personal medical information alongside that. So something like showing your vaccine card would be usually acceptable, or something from the pharmacy that says this person was vaccinated. You want to affirmatively stop people, though, from trying to give you additional information that might be confidential medical information, like the reason why they were eligible to get vaccinated, or the answers to any of those screening questions that they ask before getting the vaccine, things like your family medical history and things like that. So yes, you can ask for proof. You just want the minimal amount of proof that you can get from them, something like showing their vaccine card, no additional medical information.
Great, thanks. So another one that's probably in your department where people kind of asking the flip side of the question of can they enforce a mandate? It's if they choose not to enforce a mandate, forcing all employees to get vaccinated, what if someone gets sick? Do they face liability there for not providing a safe workplace?
So possibly. This is such a fact-intensive question. It's one of those that I'm going to give you the Weasley lawyer "it depends" answer to. You want to be able to take the precautions that are necessary for your workplace. We don't have guidance right now that says employers must mandate vaccines in order to provide a safe workplace. I do not anticipate that legal guidance will come out that vaccines are required. But depending on the other things that you're doing in your workplace, it might be a contributing factor to some liability. So if you're not requiring masks, you're not requiring vaccination, you're not requiring distancing, you're not if you go down the checklist of things that could prevent COVID transmission, it could potentially end up on that list. Time will tell as people file lawsuits and kind of how that plays out. But I wouldn't anticipate it being like, oh, you didn't require a vaccine, therefore it's your fault people got sick. You will have to keep up with your whatever's the applicable safety OSHA or your local OSHA agency, and keep up with their recommendations and stay abreast of whatever precautions they're suggesting workplaces of your type take. But it's really just one factor among a lot of factors in the safety in the workplace.
And we'll conclude with this one that a lot of people have asked, and this is kind of a Jennifer and Robin question. It's about volunteers, and can we be requiring vaccines of our volunteers? Can we be asking our volunteers for proof that they've been vaccinated? So Jennifer, I'll kick it to you first, and it may come back to Robin after you.
Yeah, and actually maybe Robin, the problem in the US is that there aren't a lot of actual laws that apply to volunteers and volunteer work. So our best recommendation is to try to match parity as much as you can with paid staff and to understand where those policies are coming from to mitigate both those hard risks and those soft risks. So is it a good idea to make sure everybody's safe? Yes, but as far as the actual legality, I would defer to Robin.
I will echo Jennifer that there are not a ton of laws that directly address this issue for volunteers. The things that would be of potential concern, though, would be the same things of potential concern with employees. So watching out for those potentially protected categories, disability, religion, or anything else that your state might require from that perspective, and trying to enforce your policies in an even-handed way, because the way that these things really rise to become a concern is somebody thinks that they've been treated unfairly. So the more that you can give both in the spirit and meeting the requirements of the law of treating everyone as fairly as possible, is going to be better for your legal exposure.
I would also say, just to piggyback on a little bit of what Crystal was saying, is that we want to be really thoughtful and careful about incentives to volunteers, because that can start to cross that barrier between what is a volunteer staff person and what is a paid staff person. So we don't want to get into that gray area where there's questions about whether someone's entitled to back pay. So.
Great. Well, thank you both. And thanks everyone for sticking around past the top of the hour. We do have a lot of other questions, but you've been very generous with your time, and let me turn it back to Tim to conclude us.
Great. Thank you, Rick. And thank you, Robin, Jennifer, and Crystal for some fantastic presentations today. We all learned a lot. As I mentioned at the beginning of the webinar, we will be sending you an email that will contain links to today's presentation as well as Wednesday's presentation. And as more information becomes available, we'll be continuing to update our website at councilofnonprofits.org, and share resources via our newsletters. A special thanks to your part-time controller for making today's webinar possible. We hope everyone will continue to mask up and get vaccinated, get those shots, mask up. Nonprofits, thanks for what you've been doing for our country this last year. We still have a way to go, and everyone's depending on nonprofits to provide that leadership. So please, let's go forth. Shots in, mask up. Thanks, everybody. Have a great weekend.